Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Welcome to another Q&A series. This is a Monday series where I answer your direct and specific questions. So if you do have a question that is specific to your situation that you're struggling with, please put it below in the comment section. If you would like more privacy, you're welcome to email it to me. My email is in my bio. My email is very easy. It is Natalia@DrZPhD. And make sure that your questions are not diagnostic in nature. And if they are, don't worry, I will let you know whether I can answer these questions or not. Really enjoying this Q&A. I noticed that a lot of people are benefiting from them. And I noticed that a lot of you also get feedback and a guidance on your specific question, which is helpful in multi ways. For today's, I have selected randomly 5. I went down to 5 instead of 6 because I noticed that they've been taking longer and we all have shortage of time these days and everybody has limited attention span. So we're going to be doing 5 questions from now on. As always, there is going to be timestamps below for you to jump around topics if you want to. Also, I have blocked out everybody's name for privacy reasons. Yeah, let's get started. I'm excited about these 5 questions I randomly selected, so not sure what to anticipate yet until I finish this recording, so let's get started. Hello, Dr. Z. Dr. Z PhD. First, I'd like to say thank you for your time and care. You are very, very welcome. It is absolutely my pleasure. My question is, why do some trans feminine people not develop much, if any, breast growth, and is this common? Thank you. This is a great question because a lot of trans women are wondering what potential breast growth you may achieve on hormones. And I'm going to link below the big mega blog I recently wrote about trans feminine transition, where I talk about things that influence to what effect you will get feminization effects, as well as effects of spironolactone, if a lot of you are taking Spiro, as well as issues that may prevent feminization. If you read this blog when I first put it out, I would recommend rereading it because when I first put it out, I made a mistake from putting together all my blogs, and that's not actually how you're supposed to do cornerstone content. I'm just learning, so I rewrote completely, linking to other things. So if you've seen it the first time, it's completely different blog now, so I recommend you rereading it. But to answer your question, so in terms of breast development, in terms of just in general, being able to get maximum effects of feminization on feminizing hormones, a lot of things influence your ability to get the maximum feminization. Some of these things that do influence are your age, how old you are, how your body metabolizes hormones, your regimen, what is your doctor, your administration, route of administration, because for some people, being on injections is far better in terms of results. I know people consider it's anecdotal, but this is just the way it is. I don't think it's anecdotal because I've seen it again and again. For some people, oral administration works better. And for some people, patches do amazing things. And for some, it is pellets. So it really depends your route of administration. It depends whether progesterone has been added or not, about 6 months and being on hormones. And it also depends on what the effect of testosterone has done to your body throughout the age. So there's numerous factors, including your genetic composition, including your overall health. This is why no two trans women are alike in terms of receiving results on hormones. Since you're specifically interested in breast growth, what I gotta say is this. When I work with clients, and keep in mind, I'm not a medical provider, but because I work with people who are on hormone regimen, I spend time educating myself on how that regimen affects people. So that way I can give people suggestions to take it then to their doctor. So I'm going to give you a suggestion to take to your doctor to consider. 1. Spiro, if you're on Spiro as anti-androgen in order to reduce testosterone, spironolactone has been shown to really not help much, actually stifle breast growth production. So the first thing I would recommend doing is talking to a medical provider and asking if there's another type of anti-androgen that you can take, or if you even need it at this point. A lot of you, keep in mind, estrogen in of itself, for a lot of you, is enough to lower your testosterone levels. So you may not even need to be taking any blockers or antiandrogens. So that would be number one suggestion. Talk to your doctor about that. Number two, have your doctor prescribe you progesterone? If no, talk to your doctor about introducing progesterone. And if your doctor brings up, oh, there's concern about risk of cancer, read my blog, because there's also a study that has been done that there is no risk to cancer. The problem with transgender therapy is that it is constantly being equated to that of cisgender population. And the reality is that you have your own needs, and it's not fair to generalize what happens to cis women to trans women. So progesterone. If you're already on progesterone, have you witnessed any potential spike in your breast growth? And finally, the third things that I would suggest for you is to discuss with your doctor what is your route of administration. If you are on oral estrogen, and if you've been on oral throughout your whole up to this point in your hormone transition, try switching. There is something about switching, the way the estrogen is administered, that suddenly kicks up change productions in the body. I see this again and again and again. Your doctor might say it's anecdotal, there's no research. And yeah, there is no research, but we also can negate lots of trans women talking about these things, lots of trans women reporting that they saw much more feminizing effects on injections versus other route of administration. We can negate it. Just because we're not studying and documenting it doesn't mean that it's not true. If you especially feel like your breast growth has stiffened or you're not getting as much, those three things are going to be really, really important for you and it's going to really, really helpful to you. Anybody who's watching has probably experienced benefits of any of those three: benefits of progesterone for the breast growth, benefits of getting off spiral, benefits of changing and switching your route of administration. And try that and see how that works. But is it common that you have, you said not develop much, if any, breast growth? Yeah, it is common. I wouldn't say it's super common. You should develop some. I see a lot of trans women develop at least like a pretty good B cup, maybe even like A plus cup. So completely not having any results. I haven't really come across, I'm going to say it this way, I haven't come across any trans women that have seen absolutely zero effects. A lot of times it really is finding regimens that working for you. Remember, hormone is all about finding that right mix that works for you, that works for your body. And I cannot stress how important it is. This should be number 4, by the way, to work with a really good endocrinologist who knows what they're doing. I know that some places it's really hard to find them. And a lot of times you just have to advocate for your care and you have to ask for those things. But I talk about all of this in a blog I'm going to list below for you and anybody else. It's very, very informative. You don't have to do anything to read the blog. You don't have to sign up for newsletter or anything. It's just a blog, and it contains really good information for all of you. So hopefully that answers, and good luck. Let me know. Please keep me posted. You feel free to email me. Just let me know what changes, if any, you made and how it worked out for you. Next question. Good evening, Dr. Z. Firstly, thank you for your YouTube and Facebook content. It has helped me immensely. You are very, very welcome. I'm 48 years old, trans femme from Australia. I have a wife and 3 children, 10, 8, and 4. Oh boy, they're young ages. I got overwhelmed. I'm sorry, I got overwhelmed. This is my stuff, by the way. I don't have kids. I don't want to have kids. So I got overwhelmed. Really, you have 3 kids. My headspace went into, oh my goodness, fear mode of how overwhelmed I would be if I had 3 kids of that age. I feel I have a huge amount of guilt in relation to transition. I had been dressing since 5 with no understanding as to why. I have suffered depression my whole life and never felt I feared it anywhere in life. I hid behind most masculine pastime I could enjoy, which was all things cars. Okay. So sorry, it's when I take your questions from email, the font is really small for me. Not anybody's problem, just my eyesight. I now don't enjoy them as much. It just doesn't feel right. I suffered a brain tumor in 2013. Oh my God, I'm so sorry. I'm glad you're here. Wow. Which is fine now, but during therapy, I rediscovered dressing. I told my psychologist, who dismissed it as not, as not, what is this? As not, oh, it's just as not. Okay. I'm sorry they dismissed it. They shouldn't have dismissed it because it sounds like this is something that's really important to you and has been with you since you were 5 years old. Since then, I have been honest with my wife and kids. Good. I put it down in cross-dressing, but since 2017, I have been slowly transitioning. My wife is mostly accepting, and it might be very hard for her. I'd recently been offered a role as female international flight attendant, but it means big changes, one being leaving full-time, and two, a substantial pay drop. I feel it's really great steps that may lead to more beautiful, to some beautiful, and but I feel my wife is unhappy about it, and I have a huge sense of dread and guilt if I do this for myself. I would love your thoughts. Okay, so I'm sorry if it took me forever to read this. I have to remind myself, bifocals, Matt, bifocals, time to get bifocals. This is a great question. First of all, like I said, I'm so happy you're here and survived brain tumor as a cancer survivor myself. Um, yes, let's kick cancer's ass. So you've been struggling for this since you were 5 years old. Cancer in 2013 brought you probably to realization, and it's probably like always life type of situations that are really close to death, that are really close um, to kind of really serious shifts in our life will bring up realizations. Even if it's been staying dormant, it will bring up those elements of your identity to the surface. And for you, it was during this cancer period, it brought it up. You started to realize that you have to deal with it probably. You talked to a psychologist who dismissed it, unfortunately. And you've been open with your wife and kids, which is amazing. Good for you. And I hope that they're giving you the support that you need. Um, Now, in terms of whether you should pursue transition and whether you should fully pursue your life as a woman and take the job as a flight attendant, even though it's going to lead to a pay cut. Here's my perspective on this. You demonstrate a lot of guilt toward your wife. You even assume that it must be very hard for her. Do you know for sure it is very hard for her? Um, a lot of times when we've been in a relationship for a long time, we shift the way we see things and the way we understand things. So talk to your wife, see what she has to say. I honestly feel that given that you're already going through some elements of gender transition and starting to feel a desire to feel more happier and to embody who you are, and this job sounds like an opportunity for you to do that, I I feel it's important that you owe to yourself to ask yourself how far you want to take transition for yourself. What are your needs? How far do you want to take it in terms of, do you want to go to surgeries or not? What would that mean for you? With the job, it's a little bit more challenging because I don't know how much pay cut will affect your overall financial household redistribution. For example, if you're a primary breadwinner, will that really drastically affect your children? Would then affecting your children in drastic way would then further, most likely, will lead you to feel even more guilty about your situation. So that's a different question. That's a more question, much more evaluating, because you are in a family, you have kids, you have a wife. That's a more question of finances and how it's going to affect all of that. If it's not going to really affect, or if lifestyle can go down a little bit, it's not going to be detrimental to the kids. I think career change is a beautiful thing. I do think that life, when we step, and I said this before, when you step, all of you, when you step on the path of acknowledging who you are, life suddenly starts throwing you these little breadcrumbs. Universe, life, God, source, whatever you want to call it. But certain energies are starting to, like magnets, be attracted toward you because they sense you need it. You need this. It's not as surprising that this job is coming up. Now, it may not mean necessarily that the job is telling you that you need to become flight attendant, but it might be telling you that it's time for you maybe to make more steps. So it's really important to listen to what makes you happy. You have to maybe sit down, I would advise, and write down pro and cons. What would be all the pros of going full time and taking this job? And then write down all of the cons. Right? Make sure you break down your pros and cons into logistical, how much will taking the job will affect financially my surrounding, my lifestyle, my family's lifestyle. So those going to be more logistic, more concrete, objective things, and subjective psychological things. How much me going full time will it really be hard on my wife? What can we do to deal with that when we cross that bridge? And a lot of times you will realize that your subjective things that you're concerned about, a lot of psychological things you're concerned about, are not even here yet. And there's things you are assuming, presuming, projecting into the future. And you have to trust that when it happens, you'll find resources and capacity to cross that bridge. It's hard. I am of an opinion that everybody deserves to be fully happy. I don't like suffering. I don't like coping that reduces suffering. I've seen a lot of individuals who say that they don't decide not to transition because they would be giving up too much as a result of it. And that's okay and that's valid. Why? Because they made the decision to not pursue this transition while understanding what they will be giving up and also accepting. Acceptance is a huge part of it, what it's going to mean for them. But in your situation, you're pulled. I can see in your narrative, you're so pulled towards yourself. You're so pulled in desire to be fully yourself because it brings you joy and happiness. And probably that cancer scare in 2013 also put some things in perspective. And call me biased, but I feel like you owe this to yourself. So hopefully this is helpful. I apologize I could not be more clear. Maybe some other people can help you and give you some input. But think about what I said. Maybe making those columns, pros and cons, are going to really help you. And I wish you all the best. And again, I'm really glad that you beat cancer's ass. Question number 3. Hello, Dr. Z. I'm from, I won't pronounce it, Longueuil, Quebec, sorry, Canada. Your advices are so on the point. Whenever it's a question I'm asking myself or one I haven't considered yet, I'm glad to hear. In my transition, I wanted so much to believe in our love that my soon-to-be 15 years married wife would be in on the transition. That we had all this background of love, so it would be easier maybe. But it turns out that she said that I was thinking only about myself. She felt disgusted, as if the person she loved for more than 70 years, 70, I think you meant 17, probably 17, because I don't think you've been together 70 years, right? 17 years would suddenly be different, that my body would be different. I understand the shock. I wasn't prepared for it neither. I'm still going through with HRT, but I wonder what will happen in the long term. I have been hiding from her all along, of course, but being here right now with all I have done, can I really go on and live my life without doing what I really needed to do for so long? I am nearly 50. I spent all my life being who I was. Let's spend the rest being who I am. Okay, so this is a great question. This also has similarities to the first question. Person's in a relationship, very long-term relationship, 17 years, congratulations. And you thought that your love and bond that you two solidified is going to be enough to propel you forward in spite of gender transition. And you're finding out that your wife, or I don't, did you say your wife or your partner? I apologize, I'm gendering them immediately. That just shows you how brainwashed we all are to automatically gender spouses as females. Your partner is basically saying that they feel that this is selfish on your part. They feel that you're only thinking about yourself. And she also felt disgusted when you probably presented yourself, or maybe started to see changes in hormones, or maybe you started to feminize in front of her, and she also felt disgusted. Again, I just noticed you didn't tell me what gender you identify with, and again, I made that projection. We all have got to work on catching ourselves when that happens. So what do I think is going to happen? I also wrote a blog post that I'm going to link below about two main factors that influence whether a relationship is going to survive. And one of them is, what is your emotional bank account? Up to this point, is your emotional bank account full? A lot of people feel that their emotional bank account full, but they're being not fully honest with themselves. And the reality is that the relationship has been deteriorating over the years. And for a lot of spouses, a lot of partners, it gives, when partner comes out, it becomes a final straw to end something they've been already thinking about ending. So first is going to be what the emotional leverage of your account is. And I'm going to link that article below for you to read. Here's the thing. Your partner has already expressed that they feel disgusted by your identity, your gender identity presentation, and then they think that it's selfish. I find that for partners who express this, it is often difficult to work through it because they're indicating that they don't find you attractive. They don't find you maybe sexually attractive, also indicating that they don't find you, they don't feel comfortable perhaps even being around you. And it's very drastic and it's kind of difficult to work through. I would recommend couples therapy if you haven't thought about it already. What I can tell you for sure, and I'm pretty darn sure about it, is that if you're going to pursue your authentic self, which I think you should, I think we all can agree is that authenticity and being yourself is important in the parameters of the marriage. And if you and your partner do not work on these issues, and if your partner cannot be comfortable with your new gender identity and how you present gender identity and the person you're evolving into being, the relationship is not going to work out. It cannot work out because the essential ingredients needed to make it to work out are not there. What I can also tell you for a fact is that if you don't pursue transition, hoping that you're going to save your marriage, I personally don't understand how then you eventually will not resent your partner because you already told your partner about your gender identity. You already even started, I think you mentioned starting hormone regimen, yes. And I think that now sacrificing yourself in this case in order to appease and make your partner happy is going to breed resentment because every time you're going to want to feminize, every time you're going to want to express yourself, you're going to be holding yourself back because your partner feels disgusted. Every time you're going to be reminded how they feel about you, you're going to start slowly accumulating resentment and contempt, and you're going to slowly start blaming them that you do not have access to your happiness. But in reality is that you shouldn't really blame them and they shouldn't blame you. The two of you are at a crossroads in your relationships where things have changed because of gender dysphoria. And a lot of times in marriages, people end up at crossroads. Either it is gender dysphoria, something else happens. A lot of things happen to people. People develop addictions and it becomes a crossroads. People suddenly lose their jobs and that becomes crossroads. People suddenly have a disability or health concern and that becomes crossroads. Marriages are not guaranteed. Committing in the beginning of the marriage or relationship that you're going to be with this person forever is an illusion that we all buy into. Nobody can guarantee because we're constantly evolving and shifting as human beings. We can all hope that we continue to be in love and we continue to evolve together with our partners, but it is not guaranteed. So you find the two of you are at a crossroads right now. And because you're two at a crossroads, you two are trying to figure out what to do. So before you make a decision, I would recommend sitting down. If you can sit down with a therapist, that would be even better. If not, just sitting down together and honestly have an honest conversation. This is what's happening to me. I'm at a point where I have to deal with my dysphoria. That includes transition. This is where you're at. You're realizing that this is not, you feel like I'm not the same person. You feel like I'm going to change or changing to such extent that you just cannot even be around me. What can we do about it? How can we maturely evolve together? Can we evolve together? Is there an opportunity for us to grow together? And if there's no opportunity, it is a very mature and very assertive thing to call it an end. I know it's hard. I know that when you invest 17 years, I've been with my honey bunny 17 years, and it's an investment. And the more we invest, the older we get. So, we don't also necessarily become, um, I don't know. I'm not going to go there. But anyways, the point I'm trying to say is that I get it. It's investment, and you invest it in your relationship and you don't want to lose it. But also remind yourself, if you're going to now continue investing in it, what are you at this point investing in? Because things shift and it's okay to shift. So I hope you'll be able to come to some kind of decision. It's a tough one. Relationships are always tough. And to hope that love will carry people through transition, I apologize to say, just doesn't work out like that, because your partner married you also because of your gender identity. And I wish we lived in a world where gender identity, even for people, it is changes, didn't really matter to partners, but it does. And as I always tell all of you, if my husband, who is cis male, came out to me and said that he's trans, would I be with him? I'm telling you all right now, I don't know. What I do know is that I will support him 120%. But could I be and continue to be in a marriage with a trans person when so much of my attraction and sexuality also dependent on gender? I honestly don't know. I hope that I'd be a bigger person to say yes, I can. But I don't know. It has nothing to do with necessarily trans people. It's just that we all have certain attraction, and sometimes that attraction, a lot of times that attraction for a lot of us is very static and very sad, and it becomes a deal breaker because relationship and sexuality, or I should say sexuality, is a really important part of relationship too. So I wish you all the best, and hopefully some of my insights were helpful, and best of luck to you and your partner. Question number 4. And my question is about a niche situation. Oh, I think I cut out, there was maybe something personal that I cut out, and now this person has got the question. Okay, niche situation. All right, let's see. I found myself questioning my gender after high school, and most of my school life was in all boys school. And even when that stopped being single gender, my classes remained all boys. And later on, when girls were in the same class, there were a significant minority, a situation that extended to my academic and professional life. Okay, so it sounds like throughout high school and your academic professional life, you were primarily in groups of individuals who were male identified. While intellectually I know women are about half the population, in my life experience, it's like they're at most 30% on a good day. Okay, so your interactions with women has been limited throughout your development. Is it possible that this external imbalance could have turned inward and manifested as gender questioning? It can be, in the very least, weird to feel unqualified to deal with half the population due to an unbalanced life experience, while part of you mind seems to pull you toward at least partially identifying with them. I could try to dismiss it as being all in my head, but there are also associated small physical issues that reinforce the thoughts around it. Each individually ignorable, but when put together, they may add up to something. I could go into greater detail, but understand the need for bravery here. I appreciate your bravery. I still find it important to try to ask about this to someone with experience in the subject, since it's quite a niche when even within the relatively niche subject of trans matters. So, interesting question, really interesting question, right? So, how much does our socialization that has been taking place and our development that has taken place primarily in gender specific environments has to do with potentially then leading to questioning one's gender? This is a great, great question. Nurture nature type of thing, kind of question. So let me try to see how I want to answer this question. I want to say first and foremost, there is no direct causation here whatsoever. I have yet to see direct causation between um, having to spend majority of your development and life in one particular group of individuals. And we know that there's no direct causality because there's a lot of people who have experiences, believe it or not. It's not that uncommon to go to all girls school, for example, and it's not that uncommon then to predominantly have most of the experiences with women, for example, and then at some point, maybe even in career, to have more interaction with women than men. I have, in my lifetime, I have the opposite experience. I have more experience socializing and spending time with men than I do with women, actually, and that hasn't caused ever any kind of gender confusion. Having said that, here's the thing. Gender identity is it's not simple because we as human beings are not simple. I believe that gender identity is a natural byproduct of reconciling mind and body and the social environment you live in. As such, I believe depending on your life, depending on exposure to things, depending on your interaction with things, there could be influences, internal and external, that could one or another way start develop your relationship to your gender identity. And in saying that, I believe that would be very natural and that would not be unusual. For transgender people, first of all, trans folks are already a lot of times predisposed to develop transgender identity for a lot of various reasons, psychological, physiological reasons, you name it. Well, I believe that people are just predisposed to be trans. For a lot of other people who well, for example, we have a lot of other people who may be really comfortable with the gender assigned at birth, but later evolved and find out that they also felt much more comfortable as other type of gender nonconforming identities without necessarily identifying fully as transgender or even without necessarily needing to transition. So what I'm trying to say is that is it possible that your socialization with only particular gender groups over the course of duration manifests as gender questioning? It is possible. I would say the probability of that, how probable, remember, anything is possible. The question here is how probable that is. The probability of this, I would say, will highly dependent, in my opinion at least, on your core identity. A lot of us have a strong sense of core identity. For example, me, I have strong sense of female identity. You can throw me into man, you can throw me into male dominant careers, you can throw me into any kind of man dominated environments, and my core identity will not waver because it's very strong. I strongly identify as a woman. For individuals for whom their core identity, gender identity, is maybe not, I wouldn't say fully developed, but like I said, a lot of factors influence how we see ourselves in relationship to our gender. And for some people, it's a little bit much more, has more fluidity, I would say, to it. For that reason, when you have more fluidity to it, it may be shaped up more from external environment versus from an internal one. Does it make sense? I hope it makes sense. For me, a lot of my identity is shaped up by my internal sense of self, and then by external, maybe I would say 10, 20%. But for all of us, it varies because we're all different things. If I were to see an individual who has started to question their gender identity and thought that maybe they're trans or non-binary or any other gender identities out there because of their environment specifically, and they develop gender dysphoria as a result of starting to question their gender and things started to feel incongruent, I would say that it's not so much the root that in this case is more important, but what's more important here is now that you're realizing that you're no longer comfortable with your gender assigned at birth, what do you need to do about it, if anything at all? So keep that in mind that, yes, I mean, like I said, we're human beings. A lot of things are influencing us. But to say that it may have caused a strong shift in gender identity, possible, yes. Probable, I I'd say small, very small probability, and that would highly depend on how stable or how fluid or static your gender identity has been already up to that point. So hopefully that answers. It's a very interesting question because a lot of people have been asking me how much, for example, orthogonophilia. I made a video about orthogonophilia and the difference between orthogonophilia, which I see as a sexual preference, sexual orientation, sexual desire, and Blanchard orthogonophilia theory, two different things. But for example, people who have orthogonophilia, who do have sexual orientation towards themselves, may over time lead to questioning their gender identity and may lead to transition, but that leading is not causality, and it's not that orthogonophilia caused it. It's just that certain parts of our gender identity are not so set in stone. For some people it is, and this is why we see people being comfortable across time no matter what they experience. Some people, their identity is much more malleable. It's much more mutable, and I don't think that's a bad thing. I think that's just how you are. It's part of your single core individuality. So hopefully that answers your question. But yeah, it's a really good question. So final question for today. Is transitioning just another way of coping? Is transition another way of coping? It depends. This is a question that is very, a little bit reductionistic. I apologize. It's not that you're being reductionistic, but when we phrase it like this, it basically says, is transition is just you're now sublimating by coping with gender dysphoria, by overeating or overdrinking, for example, and now you're sublimating by transitioning. So is it just a coping and nothing more? I'd say no. I say transition can be and is oftentimes coping that not only coping, but coping that leads to a happier life, leads to more congruency for a lot of individuals, and leads to, from initially starting off as coping to then shifting to as a healthy way of life once you eliminate a lot of other factors that causing you gender dysphoria. So coping in this case, not in a sense that I'm using transition to cope with gender dysphoria, but coping as a way of gender dysphoria in the sense is a helpful, viable option to help with gender dysphoria. Now, transitioning is not something that, as we know, not always has 100% full benefits and results for everybody, nor is it supposed to be seen as something that 100% helps anybody who has gender dysphoria. And to say that would be incredibly inaccurate. Gender transition is an option to seek the congruency in order to eliminate gender dysphoria, and for a big segment, big majority of individuals who struggle with gender dysphoria, it is incredibly helpful. There's also individuals for whom transition turned out to be not the right option. It turned out to be not the right option for a lot of different factors, including realizing that they were not dealing with gender dysphoria to begin with, or realizing that life is much more difficult as a trans person and reverting back to gender assigned at birth, or realizing that there were side effects, yes, to estrogen and testosterone treatments that really affected their lifestyle, and people felt like it was not worth it, and realizing a lot of other things. So transition is no, it's definitely not another way of coping. It's a way of I want to say it's a treatment, but I don't like the word treatment. It's a way to, it's the best option we have right now to help individuals that have severe and strong and prolonged gender dysphoria. And it has proven to work. I was just thinking lately how analogous it is to a lot of other treatments we have out there. For example, cancer treatment. Now, people have different types of cancers, of different types of stages, of different types of severity. And chemotherapy, is it 100% full improved treatment? No, I had cancer. I know this. has chemotherapy cured my cancer? Yes, but chemotherapy also gave me a shitload of side effects to deal with. Um, the same thing with gender dysphoria. So gender dysphoria, depending how long you've been exposed to it, is going to leave a bigger imprint on you. And even if a person engages or initiates gender transition, even after they feel more congruent and happier, that imprint of suffering and living with gender dysphoria may still be there for individuals. Not to mention, depending on the dysphoria and severity and what people really want to seek out of their life, transition is going to have different results. And it varies on so many things, just like cancer does, just like chemotherapy. For some people, is really helpful. For some people, they need radiation. For some people, it just really doesn't do much. It really depends. And I know people say don't compare it to cancer because cancer literally kills and gender dysphoria doesn't. And I beg to differ. Gender dysphoria absolutely does kills. And also, not only gender dysphoria kills literally, but gender dysphoria may not kill as literally as cancer obviously does, but it does kill a person psychologically. It does kill a person spiritually. It does kills a person quality of life, and therefore it's still a killing. If you're physically living, but you are psychologically dead, that is not quality of life. So we got to keep in mind to think about the transition when we say that it's not a viable option, that it is a viable option for many, not for all. It was never meant to be a viable option for all. Anybody who ever transitioned will know that while eliminating a lot of gender dysphoria, there's still obstacles and challenges. Just like me getting chemotherapy, while eliminating and killing my tumors is still obstacle and challenges. I have side effects and potentially will have more on my organs from being exposed to 16 chemotherapy treatments. That's a lot of poison in your body. Going through transition, the same thing. People are going to have consequences, and some people are going to have much more, some variable negative effects, I would say not consequences, negative effects of treatment of estrogen and testosterone, for example. Transmasculine guys, there's a lot of research right now about genital entropy for those who have not had bottom surgery and how much pain it causes and how much it really affects the quality of their sexual life. That's a negative effect of medical transition. Medical and surgical transition is absolutely going to have its own negative effects, 100%. Anybody who says it has zero effects is just bullshitting everybody. It is important to decide when you engage in medical and surgical transition as an adult, what are the negative effects, but what are the negative effects of continue to live gender dysphoria? For a lot of people, the potential of getting these negative effects outweighs this. Just like for me, getting chemotherapy and surviving and then having side effects of all the chemo outweighed living with cancer and then eventually dying at a young age. So this is how I look at it. I think it's unfair for people to throw away that transition and everybody is for medicalizing individuals. I think it's really important to broaden the scope of transition and remind everybody that it's individualistic, that people need to choose what works for them versus going from point A to point B, and that social transition for a lot of people is an incredible viable option without medical or surgical needs. Absolutely. So hopefully that answers your question. That's a really good question. And hopefully I clarified more on that as well. And that's it. That's all the 5 questions for today. Comment below. Let me know what your thoughts are. If you have any feedback on any of the questions. If you have questions for me, please comment below and leave the questions below, or you can directly email them to me. Please make sure to continue to support each other on this channel. I've seen a lot of people giving each other feedback, and I think that's incredible. Remember, for a lot of you, this is perhaps the only safest place, the only community you may feel you have, especially right now with all the anti-trans and all the anti-legislations and hate going on in the world. And you've seen this channel is getting a lot of negative comments, which is, for me personally, it's fine. Just, we have to ignore people who feel the need to destroy and elevate themselves by dragging down somebody else. But for all of you, please support each other. Stay away, stay well, stay away from those people, from small-minded people, yes, but stay well and stay healthy, and I'll see you all next time. Bye.